Intermountain Medical Center's Women and Newborn program is nationally recognized for providing the highest quality care for both mom and baby. One particular area of expertise is in reducing the number of cesarean section deliveries. Dr. Sean Esplin from Intermountain Medical Center joins us now to explain. Thanks for being here today.
Thanks for having me.
Well, how did Intermountain get such a prestigious honor to be nationally recognized?
You know, I think Intermountain's been very forward-thinking, and for a long time now we've had an electronic medical record that allows us to gather information and data and kind of look at what works and what doesn't work. And based on our own information, we've created protocols that kind of minimize the risk. You know, Utah is one of the lowest states with respect to Cesarian section rates, and Intermountain is one of the lowest hospital systems with that in that area as well.
What advancements, changes, improvements have we seen? Let's compare the 1980s and 1990s in the delivery room to now, if we come and visit you.
Well, one of the problems that we face is we're dealing with two patients, the mother and the baby, and so we often see shifts in the rates of Cesarian sections and the complications that happen during delivery when we're trying to avoid complications with the baby, and sometimes they result in complications for the mother. Now, we have a lot of information now about what's normal and what's safe, and you know, we're at a point now where we actually have physicians available 24 hours a day on site, anesthesiology professionals available 24 hours as well, that allows us to react at a moment's notice. And I think we're getting better at knowing what the problems are and what to watch for.
Well, let's say someone's watching, we have a mom out there who's pregnant or a dad who's expecting to be a father maybe again or the first time. What are some of those questions you want them to ask their doctor when they head into Intermountain Medical Center?
Well, I think it's important to talk with your doctor about their philosophy about what your delivery is going to look like, and you know, how important it is for them that you have a normal vaginal delivery. It's really important if you've had a previous cesarean section. One of the things that's driving the rate of cesarean section up across the country are women who are having a repeat cesarean section. And recently we just published a study last year from Intermountain that showed that a lot of the women who choose to have a second cesarean section were actually very good candidates to have a vaginal delivery in their second pregnancy.
So is that a myth then? I've often heard that if you've had one C-section for your first baby, you're going to have it for the rest of your babies. That's not true.
That is not true. If you've had one cesarean section, many women are great candidates for a vaginal delivery in their next birth. So talking to your doctor about the risk factors and whether or not you are a good candidate. There are actually some sites available on the internet where you can calculate your chance of being successful.
Wow.
And if we can prevent the first C-section by following kind of what we know is safe in labor and delivery, that's one way to reduce the rate of cesarean section. But a really big thing is to help women who've had a previous cesarean section actually have a successful vaginal delivery in their next pregnancy. So talk to your doctor about whether or not you're a good candidate for trying for that.
So there are, obviously we want women to have vaginal deliveries. When is it absolutely necessary to have a cesarean section?
You know, there are times when either the baby's in the wrong position that's not safe, or there are changes in the baby's heart rate that let us know that the baby's not tolerating labor. But a lot of times cesarean sections are done because we sometimes don't know for sure whether the baby's okay or not, and it's hard to tell.
Right.
So those are the main reasons.
So some reasons there, but overall you want to definitely try to have a vaginal delivery. That's recommended.
Right.
If someone has a question for you, they want to work with you, they want you to deliver or be there part of their next baby, how can they find out more information?
You know, there's a great website at Intermountain Healthcare, the Women and Newborns site, where they can link to OBGYN professionals, certified nurse midwives, and maternal fetal medicine specialists that are happy to help.
Great. And we will put this link, you just saw it on your screen, on our website at goodforutah.com. Dr. Esplin, thanks for being here.
Thank you.
Brian, back to you.